population is aging very rapidly, but yet the services and products are not adapted to the needs of our older population. So, for example, housing, transport, services need to take on board the needs of older people.
The actions we're going to implement should significantly change people's lives across the whole of Europe.
We are in a consortium with all kinds of partners with different expertise.
Well, this action plan is about reducing frailty and physical decline and undernutrition.
We believe through the appropriate deployment of technology, backed up by integrated care, we will actually devise a health system that is going to be fit and stable for the long term.
The problem is that about 50% of the people that take medicines, in fact, do not take them, do not adhere to therapy. What we are trying to do is to help this adherence.
Many people are just slowly drifting into undernutrition, malnutrition. Many elderly people with poor health, especially chronic diseases. These people will gain a lot.
We are looking at the solving barriers for implementation, and one of the barriers is the procurement of innovative services and solutions.
What we are trying to do is to have alert systems for the patients in order to tell them, to remember, to remind them that they have to take the drug.
At the moment in Scotland we manage diabetes across the whole of Scotland in an integrated way. Patients can go online and access reliable and quality assured health information and advice about their diabetes. They can access their blood tests online, and it transforms diabetic care.
So if we can do something to help people who have dementia live longer and better lives, these dementia sufferer themselves, and possibly just as importantly, the carers, the family carers of people with dementia will all benefit.
We have to involve the informal carers in our healthcare system in order to organize fall prevention. So we can learn the community, the neighbors, and to support frail elderly people to prevent from falling.
Patient empowerment will be paramount in the success of the programme, and from the point of view of the citizen, moving the power relationship slightly in their favour and possibly slightly away from the providers, I think will be a benefit.
We are determined to allow patients to be at the heart of everything we do.
The European Innovation Partnership will help us connect all those stakeholders and get critical mass for the new solutions, innovative solutions for demographic aging.
And the fact that we are coming from such different areas of the society, from industry, from ministries, from professionals, from medical people, from all over, really joining forces to pitch in and help. And that's creating a platform which is really unique.
We can't do it alone because, for instance, in our own region of 2.5 million of people, it's not possible to implement it only by ourselves. We have to deal with problems like interoperability and use of standards, and it's really helping to cooperate with other partners across Europe to solve this kind of problem.
We are good in some areas, other regions are good in some other areas, and if we learn from each other, we don't have to develop bad practices first. I think it's good if we can learn from good practices elsewhere.
Interestingly, we're also sharing mistakes. So for us, it allows us to implement faster than we would do otherwise, takes out waste, reduces cost.
I think this programme will bring a lot of benefits to European citizens, in particular people of my age group and older who will need assistive technology to enable us to live independent lives in the future.
An EIP gives us an opportunity to be involved in that and to help us to set the agendas and to help to find out how we might be part of the solution to making healthcare sustainable and to making sure that we all have a much healthier and active life for hopefully much longer than we would do otherwise.